Organizations around the country are making great strides in DEI, diversity, equity, and inclusion, and that includes healthcare. Here at VCU Health, we take great pride in the work we've done thus far, but we're not stopping there. Today, my guest is Joanne Harris Duff, Diversity, Equity, and Inclusion Program Manager for VCU Health, here to talk about how VCU Health is ensuring that all patients feel seen. This is Healthy with VCU Health. I'm Evo Terra. We're going to talk about the importance of inclusivity in healthcare, Joanne, and I want to start by asking you what may seem a very obvious question. Why is this initiative important?
Well, first, thank you for having me. And this is incredibly important. We are in this beautiful, ever-changing world, and all healthcare providers and organizations really have a responsibility to care for anyone who comes through their doors. VCU Health is fortunately in a very beautiful, diverse city and surrounding counties in so many different areas: race, ethnicity, spoken language, people of all walks of life, economic statuses, sexual orientation, gender identity, so much. And we need to make sure we're taking care of everyone. And we do that by truly embracing diversity, equity, and inclusion. And we can't forget access to care.
Yeah, it's a true melting pot today in most places, and where VCU Health is based, even more so, right? It is becoming an truly cosmopolitan area, I would say, which means we have to change. And I know change is hard, right?
Of course, change is hard, but you know what? Change is also beautiful. It's what makes us better. It moves us forward, and it helps us help one another.
Yeah, it does. Let's talk for a minute about, maybe from my perspective, one of the more complex issues, especially when it comes to diversity, equity, and inclusion. And that's because healthcare is often clinical. It's biological. And I imagine that very cut and dry reality is a challenge to the patients who are LGBTQI or gender fluid. How do we work with that?
Absolutely. I think that the complexities around how people identify in the LGBTQ community is really, fortunately, common for all of us. Sometimes we think we are not like someone else, and it's because we kind of get hung up on gender identity, sexual orientation, when quite frankly, we have much more in common than we don't. I have been with my wife for 20 years. We have 2 children. When I wake up in the morning to get ready to go to VCU Health to be the program manager for diversity, equity, and inclusion, I'm just waking up as a mom, trying to get my kids out the door and try to get to work to make sure that I'm laying the groundwork for our patients of all walks of life and how many people identify. So when it comes to people who are gender fluid or who are transgender, we make sure that we get to know every possible. So we have several diversity, equity, inclusion trainings. We have a Stepping In for Respect training where we learn about the LGBTQ community. We also even gather information when anyone walks in the door about diversity, equity, inclusion. And that includes their gender identity, their sexual orientation, their preferred name, their preferred pronouns. For example, if I was a patient at VCU Health, we have an electronic healthcare system that documents my pronouns, my gender. So my healthcare provider is going to ask me what my preferred pronouns are.
Mm-hmm.
They're going to ask what my gender is. They're also going to ask me my sex. And so when I'm thinking about sex, I'm thinking about what is assigned to us at birth. What's on our birth certificate? And at VCU Health, we need to know that. But we also need to know if people identify with that documented sex. So we ask the question because we don't want to guess. We want to make sure that patients are not simply on the bus, and the bus being their healthcare, but rather driving the bus. And they're taking it in the direction they want to go. But that means asking questions up front to everyone.
I would imagine, and please correct me if I'm wrong about this, that some people may be more likely to talk about the challenges of gender fluidity and identity and all that with a healthcare provider than they are with other people. But I may be wrong about that. It may be difficult for patients to speak with their healthcare providers about that. What's been your experience?
So my experience is if we're upfront and we ask the question from the beginning, but not only that, we ourselves come to the table and introduce ourselves as, hello, my name is Joanne Harris Duff, and you can call me Joanne. You can call me Dr. Harris Duff, however you would like to refer to me as. It's okay to call me Joanne. And so I hope that sets the stage. But also for team members, that means we need to have the training to prepare us for that moment. And that's something that we are dedicated to at VCU Health. Every team member has been given an opportunity to fulfill 4 hours or more of diversity, equity, inclusion training. And you can do that in so many really cool ways. We've got a great system in Workday that gives professional development opportunities to learn about a plethora of great diversity topics, whether that is race, ethnicity, gender, women, leadership for individuals who are first generation students. So there's so many different ways.
And as the program manager of this DEI program, how are you tracking success? How do you know it's going in the right direction? Just smiling faces around the halls, or there's some more data that goes with that?
There's absolutely data. So something that I'm really proud of that we do well at VCU Health is we gather data, not only quantitatively, but we do that qualitatively as well. We ask our team members to measure their sense of belonging. We make sure that in the diversity, equity, inclusion office, our doors are wide open and we're able to walk team members through any issues that folks have, any misunderstandings that people have. And again, that is rooted in what we learn, right? So we are truly supporting that education is a baseline. So sure, that looks like smiling faces, but surprisingly, that also has to do with people being brave enough to ask tough questions, to make complaints. And we can help anyone maneuver through difficult dialogue. We initially have a program that is about difficult dialogue and conversations. It's called Dire Conversations. We do that every month. Myself and a gentleman named Roy Roach, we come together and we host a Dire Dialogue series. And it happens every fourth Wednesday, like clockwork of the month. And we pick a topic. We ask our team members for topics. For example, next Wednesday, we're going to be talking about women in leadership. So not only are we celebrating Women's History Month, but we're going to be talking about leadership in healthcare for women.
Joanne, can you tell me something about the specific programs you are offering VCU Health members throughout the year?
Absolutely. So for example, in January, we started off 2022 with celebrating Dr. Martin Luther King. We had a guest speaker, and it was the Vice President for Diversity, Equity, Inclusion, Marcel Davis, Dr. Davis. So she was our keynote speaker, and she really talked about how we can change our world to be better. But you know what's really cool that we did before that? We had 3 students from a local middle school who read the I Have a Dream speech. It was awesome. Those kids, they read it like pros. They practiced and they were careful, and it's because it was important to them. I highlighted during that MLK program that those 3 middle school students are laying the groundwork for us to be better. There are 2 of them who want to be healthcare providers.
That's great.
Yes.
Yeah, that's an amazing win. Well, Joanne, it sounds like you're making some amazing progress. VCU Health is on the forefront of what's happening in the world with healthcare, including diversity, equity, and inclusion. And I want to thank you very much for being my guest today on the show.
Thank you so much for having me. It's wonderful to talk about VCU Health because we are a community who loves people and cares for people extremely well. So thank you.
You're welcome. If you have a question about the DEI efforts at VCU Health, please visit vcuhealth.org/DEI. Again, that's vcuhealth.org/DEI. And to listen to other podcasts from VCU Health, visit vcuhealth.org/podcast. This is Healthy with VCU Health. I'm Evo Terra. Thanks for joining me.